Good morning.
Good morning.
Hello, how are you? Good morning.
Hi, Lorraine. How are you? Nice to see you.
The NHS is always a bitter battleground in an election. This time both Labour and the Tories are getting their claims and counterclaims, as well as their hospital visits in early. But doctors and hospital chiefs in a highly unusual intervention are suggesting some of those promises should come with a health warning.
What we are asking politicians not to do is not to weaponise the NHS. So we're asking them to be really honest about the challenges out there, really honest about the claims they make.
The Academy of Medical Royal Colleges singles out two key examples of pledges that need qualifying. From the Tories, the promise to build 40 new hospitals when money has only been allocated to 6. From Labour, the idea of a new publicly owned drugs manufacturer, with questions over where the money for drugs research would come from. John McDonnell was not rowing back from that today.
We don't feel that we're getting value for money. That's why having a state sector intervention, I think in the long term will be cost effective, but actually most probably work into an agenda that patients really need.
But currently private companies pump enormous sums into creating new drugs. That's just how it works, isn't it?
They will do. They will continue to do that anyway, but this gives us the opportunity of actually competing against them.
The Tories are determined not to allow Labour to dominate on the NHS in this election, which does at least mean that whoever wins the health service can probably count on more generous funding. As for keeping the promises and threats to the NHS in the realms of the possible, the response from both main parties suggests nothing may change there.
I'm very proud of the investment, the record investment that the Conservative government have put in to the NHS and that ongoing long-term plan which the NHS asked for, which we are funding. Frankly, the scaremongering that goes on all the time from the Labour Party is what brings down the NHS and creates this challenge.
The medical think tank The King's Fund believes none of the parties so far has come up with a coherent plan for the health service.
What I'm seeing so far from all the political parties is some particular sound bites about individual problems in the NHS and social care. But what I'm not seeing is a holistic response that looks at how are we preventing people from being ill in the first place? How are we improving social care to support people who need support in the community? How are we building a workforce with the right skills and values and the right numbers of those staff?
Today, Labour was suggesting there's been a huge increase in cancelled operations, claims themselves which don't quite stack up. The NHS is guaranteed a lot of attention over the next 6 weeks, just not always the considered, thoughtful attention it needs. Romilly Weeks, News at 10.